Someone asked the good guy, I just want to inquire if someone has a Mirena IUD but it's not in good position, can she conceive? Convince. I think you meant conceive. Yes. Even when the IUD is in a good position, there's a 1% chance you could end up conceiving. And the IUD is one of the most effective tools of contraception that we have up to today. But it is not 100% perfect. It has 1% chance of failure. Now, some people are asking, what is Mirena IUD? There are two types of IUDs. There is what is called a non-hormonal IUD, which you commonly use, called the copper IUD, which can cover you from 5 to 10 years. Okay, can give you contraception from 5 to 10 years. And then there is a hormonal IUD, which contains a hormone like the progesterone you produce in your body as a woman. That hormone is called levonorgestrel. Now, that IUD is placed inside the woman's womb. And there are several types of hormonal IUDs. The Mirena is the commonest and is the most expensive. It gives you cover from 5 to 7 years. And then there is what we call the Skyrina, there is what we call the Reta, there is what we call Skyra. Now, when an IUD is placed, some of the disadvantages, which is not a common thing, by the way, don't get me wrong, but some of the disadvantages is that it can get displaced with your menstrual period. If you've inserted an IUD, you need to look at your pad. If it has come out, you need it replaced as soon as possible. Okay? An IUD, for example, user this number asked about Mirena, particularly. For Mirena, it gives you a 1% failure rate, which is 99% protection from pregnancy in the first year of insertion. Now, after the first year, the protection goes high. Less than 1% of women who are using Mirena or that hormonal IUD can get pregnant. Okay? And the protection slightly goes down after you have used it for 5 years. All right? So, yes, when an IUD is displaced in position, it can get you can conceive while it is still in place. But you can also conceive, in some rare cases, you can conceive with the IUD in the proper position. However, this is not to deter you from using an IUD, but it is also to keep you in mind that when you visit hospital and they tell you are pregnant, but you have an IUD, doesn't necessarily mean that this can't happen. It's impossible. The failure rate of an IUD is not zero. It's slight at 1%, but it's not zero. Did you know that you can use an IUD for other functions, especially the hormonal IUD? For example, someone in the comments had asked they feel a lot of pain and they bleed a lot during their menses. You can use a hormonal IUD to solve this. Visit your gynecologist for advice around this. But IUDs are overall safe and good to use, especially for women who want to delay childbearing for 5 or more years. You can also use it if you want to delay childbearing for a year or so. The common side effects include a bit of cramping in the first 3 to 6 months after insertion. You can get abnormal bleeding, light bleeding. You can get a bit of changes in your menses. But the advantage is that you don't need to remember to use. For example, for people using pills, they have to remember every day to swallow it at the same time. For an IUD, you put it in place and you're good to go. Okay? Also, the other advantage is that you can reverse the contraception immediately. you can reverse the contraception immediately. If you want to conceive tomorrow, you remove the IUD today and you're good to go. The other advantage around the IUD, especially the copper IUD, is it can be used as an emergency contraceptive. If, for example, you had sex today, you can insert a copper IUD within 5 days from when you had unprotected sexual intercourse, and you will still not get pregnant. All right? I hope I have answered your question. Ask the gynecologist. Send in more questions, I'll answer them. If you have a private consultation, you can get to my inbox. But generally, I'm going to be answering all your questions around women health and concerns in OBS and Gyne. Thank you very much.